Hey guys, my name's Shannon. I'm one of the PAs with Florida Plastic Surgery Group. Today I'm going to be going over discharge instructions on brachioplasty or an arm lift. So just the first thing to know, the brachioplasty is a same day surgery, which means you will go home the same day that you have the surgery. When you come out of the surgery, your arms will be wrapped. During the surgery, we'll put stitches underneath the skin. Over top of your incision, you'll either have glue or steri strips. Over top of that, we'll put some pads. They're just absorbable pads, just in case there's any fluid that drains out after the surgery. These pads will absorb that fluid, and then we'll put A-straps around your arm. The incision usually starts around your elbow area, goes down to your axilla, sometimes further, depends on what you and your surgeon decide on before the surgery. You can take a shower 24 hours after your surgery. You could take the compression garments off as well as the absorbable pads, and you can get everything wet in the shower. Just let water run right over everything. You don't need to scrub your incisions with anything. Just use soap and water around them and let that run right over those incisions. When you get out of the shower, make sure you do put those compression garments back on. We usually do provide compression from your hands to your shoulder, as your hands can swell after the surgery, so it is important that when you are sleeping or just hanging around the house, you keep your arms elevated after the surgery. So you want to make sure you do keep your wrist above the level of your elbows and your elbows above the levels of your shoulder. So if you can take some pillows, prop them up, and just keep them elevated. It's especially important for the first 48 hours that you do this to minimize the swelling in those areas. We will give you pain medicine for after the surgery. We'll give you a series of different pain medications to make sure that your pain is controlled after the surgery. Take them as prescribed. If you do have questions, you can always give us a call. You want to minimize the amount that you're lifting up, so we do put a 10-pound limit on the amount that you can pick up. Be careful not to pick up over that, as the surgery is on your arms and we don't want anything to happen to those incisions. Be careful with anything straining. I wouldn't reach up high for anything, strain to get anything, but it is really important that you don't pick up anything over 10 pounds. We do ask that you wear your compression garments for at least 1 week or until we see you back in the office. At that time, we'll decide whether we want you to keep wearing them or if you could take them off. We will give you some scar cream at your pre-op appointment. We don't want you to start using that until your incisions are closed, so just don't put anything on your incisions until we do see you back in the office. As far as driving goes, you can drive whenever you feel comfortable. Remember, you're going to have to operate a steering wheel, so just you don't want to do anything to strain on those incisions. Make sure you are feeling comfortable before you do start driving. Don't drive if you are taking any sort of pain medication. Like I said, we'll see you back in the office about 7 to 10 days after your surgery. Of course, if you have a question before that appointment, you can give us a call. When you do get home, things to look out for that you should give us a call immediately for would be a fever above 101 degrees, any redness or swelling, any redness or hot to touch on the incision, if there is increased swelling, if one arm doubles in the size as the other arm, if you have any shortness of breath or leg pain, please give us a call immediately for any of those symptoms. Also, if you have any pain that's not controlled with the medication that we do give you, make sure you give us a call. I think that concludes my video about brachioplasty for today. Thanks for tuning in. We'll see you next time.